We are very excited to announce the development of St Vincent's Private Hospital Werribee. I'm Grisold, the CEO for St Vincent's Private Melbourne, and within the Eastern Werribee Employment Precinct, this is a major announcement.
Melbourne's population is growing and growing fast. We've hit records over recent years, and what is important in Victoria is we have a balanced health system. We have a system that has a very strong public health component, but also a strong private component. And the recognition that the two of those need to work in unison, in partnership, is a critical part of what our philosophy and our focus on getting the best outcomes for the Victorian community in health are all about. This involvement of St Vincent's as a private hospital, as a hospital providing services to the people of the West, will be very important too, and it will add to the concentration of health services in that region, in that precinct, enabling us to work collaboratively with the private sector to achieve a very good outcome for the people of the western side of the city. So I'm proud to be here today. I'm proud to be working together with Minister Guy and with public and private sector partners to deliver outcomes that is in the interests of the people of Victoria.
The East Werribee Employment Precinct, what we're calling East Werribee, is a fantastic urban renewal opportunity. In fact, as the City of Wyndham will tell you, and the State Government will reinforce, this is one of the most exciting urban renewal propositions in Australia's history. We are looking at nearly 700 hectares of urban renewal opportunity that will be commercial, residential, light industrial, a whole range of job-generating activities in an area that has been stagnant and dormant for too long. It's an area that is in one of the fastest growing areas of Australia. It's an urban renewal precinct that is on the doorstep of a place in Australia where there's nearly 70 babies being born every week. It's an area that is crying out for health services, an area that is indeed going to grow inexorably over the years to come. The precinct itself, East Werribee, as I said, East Werribee is the largest urban renewal proposition in Australia today. It is one that is going to see thousands of new jobs, thousands of people come to live there, and this can't be done without the services to match. And this investment today, and I want to pay tribute to St Vincent's for having the courage, the strength and the foresight to invest into a precinct that within the next decade is going to be home to many thousands of people and many more thousands of jobs. And so it's going to change greatly, and not just change Werribee, but change the focus and the structure of Melbourne's outer western suburbs. It's going to be within 40 kilometres of Geelong, 35 kilometres of central Melbourne. It's uniquely placed to service both the markets of Melbourne's western suburbs and, of course, the northern suburbs of Geelong. A catchment there of around 1.5 million people, an area that is growing, as I said, one of the fastest in Australia, nearly 70 babies born every week. It's an area where health services are so important for the future. Melbourne is not getting any smaller, as we know. Melbourne is one of the fastest growing western cities in the world. Melbourne's population has grown by nearly 80,000 people in the last financial year. And this is a great credit, but also a great challenge to all of us, either in local, state or even federal government. Melbourne's population as a metropolitan area will, on ABS forecasts, become the largest in Australia in around 20 years' time. So to do so, we have to manage our city's growth well, and we have to manage the services to match that population growth, and have to do that now. Looking at precincts like East Werribee, the first real jobs suburb in a growth area anywhere in Australia, is so important to get that right. This investment by St Vincent's is so important for the other side of the equation, servicing the population which will call that catchment their home. So can I just conclude by again thanking St Vincent's for the courage, for the work they have done, for their determination to be a part of one of the fastest growth areas in Australia, and indeed for their investment, not just for the people of Werribee, but for the people of Greater Wyndham and Melbourne's outer west. To all involved, congratulations. It is a great day for St Vincent's, for the Metropolitan Planning Authority, and importantly, for the people of Wyndham and the outer western suburbs.
In the pioneering spirit of the Sisters of Charity and the foundress of Mary Aikenhead, 175 years ago, 5 sisters travelled to Australia in the hope to address the desperate need of health, education and community support. Today, we continue that remarkable mission to develop new services in Werribee for the Wyndham community. Like our pioneering sisters, we are responding to the real need in Melbourne's west. St Vincent's Private Werribee will include services of obstetrics, maternity, cardiology, orthopaedics, ear, nose and throat, oncology, general surgery and rehabilitation. It will comprise of 7 theatres, a day procedure unit, a cardiac catheter laboratory, and also, as the Minister mentioned, that there'll be on-site 80 local residents of aged care. It is estimated after the community consultation, permits and detailed design, it will be built and operational in 2016. Total cost expected to be $95 million. Our mission encompasses dignity of the human person and for the common good. Dignity in terms of respecting citizens' healthcare needs are best addressed in their own neighbourhoods and communities. The hospital will support 270 full-time equivalent employees, and when fully operational, it will care for 16,000 patients every year. Today, 1 out of every 2 mothers in the Wyndham area who give birth need to go outside the local community for their care. That's estimated at about 2,000 births and growing. Many currently travel to St Vincent's Private Fitzroy, and soon they'll have the St Vincent's Private choice in their local backyards. The new aged care facility will support residents with dementia, low, high and respite care needs, and for those residents with financial disadvantage. The aged care facility being developed on the same site as the hospital will provide an innovative model for efficient and effective use of resources. Not only sharing the highly skilled clinical support, but also the back-of-house functions, food, environmental and engineering. We are especially committed to the people who are poor or vulnerable. This will be predominantly funded by St Vincent's Health Australia, and we do not underestimate the hard work and financial challenge that lays ahead. But with the support of the community, the business and a willing government, we will be able to fulfil the state-of-the-art facility in the western suburbs. In the coming months, some fundraising will be established and business and members of the community will be invited to contribute to this exciting new development. An exciting announcement today, a courageous decision by St Vincent's Health Australia, exciting for the families of Wyndham and also for our staff and doctors. A new Werribee private hospital, 112 beds and co-located with an 80-bed aged care, all delivered to St Vincent's commitment to excellence and high standards. We are committed to providing compassionate, innovative care to enabling hope to those we serve.